Hello, all. I'd like to begin this course by providing what I consider to be an oral history of the profession of substance abuse counseling. The information presented in this microlecture will help you complete Week 1 Quiz 1 as well as Week 1 Discussion Question 1. I've compiled much of this information through my own curiosity about the profession while I was long into my career. I realized there was much more about the history of substance use counseling that I didn't know than what I did know. The first important point is that this is a relatively young profession. Young meaning this profession has only been around for about 50 years. Now, that may not seem like young to some, but compared to other fields of behavior, social science, treatment, it is. For example, psychiatry has been practiced for nearly 200 years, as has social work, which now begs the first major question: how were people with addictions helped before substance use counseling was created? I'll be answering this while providing critical dates in the chronology of the profession. Well, nearly a century ago, during the early 1900s, people with addiction were treated by physicians, doctors. One of the first truly dedicated specialized locations for addiction treatment was at a hospital in New York City. The town's Hospital for Alcoholism and Drug Addiction was the facility where AA co-founder Bill W. received treatment for his drinking. Physicians viewed alcoholism as a condition which was treated medically first, but with a major emphasis on client willpower and desire for abstinence, which was the foundation for Alcoholics Anonymous. The first big book of AA was published in 1939, and prior to then, most Americans believed alcoholism and addiction was a behavioral choice, likely due to moral weakness. However, the founders and early members of AA advocated for alcoholism to be treated as a disease, and their views were reflected by the medical community. In 1952, the American Medical Association defined alcoholism as a primary chronic disease with genetic, psychosocial, environmental factors influencing its development and manifestation. This definition coincided with another major milestone in addiction treatment: the opening of Hazelden's Residential Treatment Center in Minnesota. Hazelden set the standard for many of the subsequent residential treatment centers, which specialize on treating addiction using the AA principles within a 28-day length of stay. Just think of any time a residential addiction treatment program is featured in a movie or television show, and most likely it is a copy of the Minnesota model. In 1954, the state of Minnesota also provided us with the first official job description of a specialized occupation known as counselor on alcoholism. I'll discuss the role of different states on the profession next. 1970 is significant to substance use treatment for a couple of reasons. First, Congress and President Nixon passed the Comprehensive Drug Abuse Treatment Prevention and Control Act. This legislation may have been a direct attempt to control the substantial drug use among the young hippie culture in America at that time. This legislation also created the Drug Enforcement Administration and classified substances into 5 controlled classes, ranging from Schedule 1 to Schedule 5. Schedule 5 drugs are determined to be those with the least addictive potential, and Schedule 1 drugs are those which are the most addictive and are completely prohibited, such as heroin, ecstasy, methamphetamines, etc. Later that year, the Hughes Act was passed, which established and expanded federal funding for treatment and rehabilitation of addiction. This also created the National Institute on Alcohol Abuse and Alcoholism, NIAAA, and the National Institute on Drug Abuse, NIDA, which serve as research authorities on addiction. Can you believe before 1970 there was little to no research conducted on addiction? So, during the 1970s, federal monies were distributed to states to determine their own, to states to create substance use treatment programs. However, the government agreed to allow each state to determine their own guidelines for qualified treatment providers or counselors. Many of the states began creating treatment centers, however, other than hiring physicians and nurses, did not have specialized clinicians on addiction. So many of the first substance abuse counselors hired as paid professionals at these programs were members of AA, individuals who were in recovery from addiction themselves. Many of them were not required to have more than a high school diploma, with the only real qualification being they were in long-term recovery. This hiring practice created inconsistencies in educational and license requirement throughout the country. The minimum education requirement varied from state to state, and therefore it has been difficult to determine national standards of substance use counselors. For example, some states require a master's degree in order to meet the qualification for licensure, while other states only require a bachelor's degree. State licensing boards have adopted higher education requirements into their licensing requirements after they've determined a high school diploma and experience are not enough to be a clinician. That brings us to 2016, when for the first time ever, the U.S. Surgeon General, the highest ranking physician in the country, published a special report on addiction. It is the highest authority publication on the profession. In it is featured support for specialized treatment, substance use counseling, and the impact it has on public health. Looks like we finally made it. Here's some references, but for more information about our profession, complete the required readings from Chapter 1. Enjoy!